business business structure have chosen not to deal with insurance, and certainly haven't been billing Medicaid because it wasn't even possible until next week. And so in order to bill Medicaid, there are 2 layers of providers. The treating therapist has to be a rendering provider and has to have their own Medicaid number. So each therapist will need to become a Medicaid provider for the state of Colorado. And we have, actually, you had a wonderful task force of therapists from Colorado that have worked very hard on this. And there is a document that kind of gives the high points of getting your Medicaid number. And the process should not be that difficult, although it typically takes 4 to 6 weeks. So once your therapists are providers, there also has to be essentially a group provider or a billing provider, okay? So if, for example, if a PATH center employed a physical therapist who's going to incorporate hippotherapy into her physical therapy, she or he has to have their Medicaid number, and that PATH center would have to have a billing Medicaid number. That's critical, okay? Now, in order to get a Medicaid number, each entity, both the therapists and the facility, if you will, have to have what's known as a National Provider Identification Number, an NPI number. Most of the therapists are familiar with NPI numbers because most of you are working, many of you have worked in other facilities in healthcare where you had to have an NPI number. And basically, it's a national registry of every individual in healthcare. And it's a number that stays with you, regardless of if you change employment when you're like an individual healthcare provider. As a business or a practice, or a facility, or however you want to describe yourself, you also have to have an NPI number. So it's easiest for me if I put those in the terms of my own practice. Skyline Therapy Services is a pediatric outpatient clinic, does PT/OT and speech, specializes in hippotherapy as a tool. It has a group NPI number. My 7 therapists all have their individual NPI numbers, and it's really easy to do. You just literally go to npiregistry.com or .gov. Anyway, just Google NPI, and it's a quick process, and they email it to you actually within just a few days. You fill out a form and you get it back. So on 2 levels, that has to happen. Okay, let's see. I got those 2 pieces. The other piece of this, and I'm going to go ahead and throw out there for your consideration, is that as a PATH therapeutic riding facility, that's what you're leading with. That's what your industry code is. That's what your business entity is if you're providing adaptive riding, and in most cases. And the therapy has often been kind of added as a secondary service. So you're going to have to figure out how to reflect that business-wise, because as an adaptive riding or therapeutic riding facility, your industry, your NACS industry code is basically under recreation, whereas a therapy practice, a self-contained therapy practice, will have its industry code as typically as offices of occupational, physical, and speech language pathologists and audiologists. And where that's important is sometimes in the application process for like the Medicaid number, or for, I don't recall it so much in the NPI number. But anyway, somehow it has to reflect that you're providing a healthcare service. So, y'all don't need to run out and start a whole, there's several different ways to approach it. You could literally set up a side-by-side business structure of your adaptive riding and your therapy practice. Or you can have a primary identification as an adaptive riding facility and a secondary service identity as a therapy practice. That's one way to approach it. Another way to approach it is if you're not going to employ your therapists, but they're currently contract providers, independent contractors, that's fine. They are going to have that dual role of being both the billing and the rendering provider to Medicaid. Okay. And that's fine. But then in order to keep it clean, and bearing in mind, I'm neither an attorney nor an accountant, but keep it clean, there needs to be a formal business associates agreement between the independent contractor and the PATH facility, so that it's, and then that independent contractor is basically a business unto themselves. Does that make sense so far? Okay, so I want to make sure, because I've hit three key things. I think they're the three big things that you need to consider as far as the straight Medicaid goes. Does anybody have any questions right now? Or Autumn or Heather or any of you that have been through this process, if you have anything to add that I've left out, please share.
I just want to mention that I put the tips for enrolling document in the chat.
Oh, perfect.
For people.
Thank you.
So everybody, if anybody has trouble downloading that, just let me know and I can email it to you separately.
And I will tell you, the Medicaid office is very vested in making this process user-friendly for you guys. So I know they say that. I mean, I know that sometimes it's hard to get to the right department or whatever, but anyway, I think they're very excited about this. So any questions or comments, any other comments or anything right now? Is it sort of clear what I said? Okay. All right. So the other thing that I sort of kind of at least bring you up to date on, to the best of my knowledge, is in the past, of course, Medicaid excluded it, but your Medicaid waiver had a provision for hippotherapy rendered by therapists, and that we are working very hard to help the waiver folks make a segue so that rather than paying for a non-existent service called hippotherapy, that hippotherapy would be a treatment tool under standard medically necessary PTOT and speech, and the waiver program would transition to providing reimbursement under the budgets for clients under the waiver for adaptive horsemanship. And that wording has actually been fairly thoughtfully provided to them, because that widens it up so that any interactions with horses, ground activities, mounted activities, whatever, would hopefully fall under a community-based service that the waiver would reimburse for, following the guidelines of how y'all's waiver is set up to approve services. And where we have been working closely is to try and get the credentialed therapeutic riding instructor, the certified therapeutic riding instructor, treated as an approved, provider, I guess, or, under the waiver to render adaptive horsemanship. And so that's the correct way for it to be, because your waiver doesn't pay for therapy services. It pays for some other services that can be deemed necessary by an individual's team. And that team is, somebody who actually works with the waiver can tell me better what that team is. It's not just a, sign up, oh, I want to do this recreational activity. It has to be justified. But that's what we're trying to accomplish. Now, it hasn't come to fruition on the July 1st date, to my knowledge, correct, Kathy? I mean, we're all
No, they are, their timeline is they want to have it rolled out by January of 2025.
Okay.
Okay.
So,
Ruth,
right, and that would be the earliest. Okay.
Right. So, Ruth, before you continue on the Medicaid waiver,
Sure.
there was a question that came directly to me in the chat.
Okay.
What about as a hospital outpatient employee? Do we also need to get an individual Medicaid number or rely on the clinic to provide that?
If you're working for a hospital and you as a therapist are basically going somewhere and incorporating hippotherapy as a treatment tool, you're already set up, because your hospital will have its business structure and its billing ID. So that'll be easy. They'll know how to bill Medicaid. So does that answer your question? Whoever asked it.
You're
Yes.
still going to have an MPI number personally.
Yes.
And
Yes.
then the hospital or the outpatient facility that you're working for, they have like a group provider NPI number.
Right. But if you're working as a hospital employee, you already have an MPI number because that's a requirement in standard healthcare. So, I mean, I think a number of therapists who have been, not just in Colorado, but across the country, who have been providing this hippotherapy service that I put in quotes under various Medicaid waiver structures may not have had NPI numbers because it's kind of slightly to the left of mainstream healthcare. But anybody that's working in a hospital, in an outpatient clinic, private practice, you know, whatever, if you're in healthcare, you should have an MPI number. So.
And yes, they said it did answer their question.
Oh, good. I'm glad.
Is there another one? No.
Okay. So the problem with the time lag between y'all being able to incorporate hippotherapy under standard Medicaid and this 6 months where the waiver is going to continue to provide hippotherapy rendered by PTs and OZs and speech is very, very uncomfortable for me. It's very messy. And it has happened because apparently there are some pretty strict procedural guidelines for making changes in the waiver services in Colorado. It can't be done very quickly. And it's the reason it's uncomfortable. But I think one of the reasons it's taking 6 months, and this is just my own personal opinion, just take it for what it's worth, but they kind of created a mess for themselves because there is no such thing as hippotherapy as a service. To require it be provided by a therapist under a system that doesn't actually pay for therapy, i.e. PTOT and speech, is kind of a problematic scenario. To make the segue is they're just needing to really dot their I's and cross their T's. And I think it's also a bit of a departure for them. The certified therapeutic riding instructor is sort of a different kind of provider than they have standardly. And so, but I think I think they're fairly committed. That's my sense. And so that'll just be so beautiful. And quite frankly, that will help set the stage nationally if we get this pulled off in Colorado, because this is a similar problem in several other states where waivers have kind of created their own deal. What's critical is that under the Medicaid, under straight Medicaid, you will not be using that S code. S8940 is a no-go in any way, shape, or form. Okay, so you just use your standard CPT codes, you do standard documentation. It's based on medical necessity for that person to get PTOT or speech. And I don't have an answer on how they're going to handle that with a potential duplication of services, because if somebody qualifies for physical therapy under Medicaid, therapy is part of that treatment plan, that's one thing. For that person to also get hippotherapy as a service under the waiver, like that's not okay. So I'm not really sure how they're going to, I don't know what their transition plan is. And Adam and Kathy, I don't know, or if anybody else has any information thus far on that.
I'm
Yes.
under the impression, I know from Imagine at least,
Mhm.
that they just said you can no longer build a CES waiver for hippotherapy.
Okay, that would make the most sense.
Mhm.
That actually would make the most sense. And that would be the cleanest way. And then they're going to take 6 months to kind of their policies and figure out their requirements so that everything's in a row for it to be approved on a client's waiver budget. That actually makes me feel better, because Autumn found some stuff just kind of Googling around and it didn't look like anything had changed yet. And so we were just like,
So there's
I
two
don't know if
things.
that's universal. I just know
Right.
Imagine said that, and I know a couple others have said that. So
So there's
Well,
two things in the chat, a couple of
okay.
things in the chat. First of all, Adam said that the answer to that will be provided. They won't provide an answer to that until after July 8th.
Okay,
What I think, Ruth, is from a center's perspective, what we are saying, what we are suggesting and telling everybody is, as of July 1, PT, OT, and speech can be billed to Medicaid under the PT, OT, and speech codes.
oh,
The billing to Medicaid, the Medicaid waiver program is getting cleaned up, but it's going to take 6 months to clean it up, because right now it says, what does it say? You're billing that it's therapeutic writing provided by a PT, OT, or SLP. That's how messed up that language is.
right.
So in an ideal world, to keep it clean, you wouldn't be billing to Medicaid waiver for the next 6 months, because the plan is, and what we're working towards, and what they are working with us towards, is that as of January 1, 2025, you will be able to bill adaptive therapeutic horsemanship activities provided by a CTRI, whether that's writing or groundwork or equine assisted learning or whatever, can be billed under the Medicaid waiver program. So that's what we're that's probably why Imagine has said that, and that's what we're working towards.
And that would be my recommendation, because I think the thing that every therapist needs to always remember is that you need to protect your licensure. And fortunately, this has never exploded. I have been worried about that, but it hasn't. And we might just kind of ease through this whole thing. But I would highly recommend, if you want to be, serving those folks that, many of the folks that are on the waiver have Medicaid coverage. And so you just need to kind of segue over and do what you need to do and the reimbursement rates for each individual code are actually look to be a little better than the actual rates that the waiver provides. And so that should make everybody feel better too. It's not like it's going to be a loss of income. And it's just going to be a heck of a lot cleaner. It's better for you for your malpractice and liability insurance coverage, because you're due as a licensed PT, OT, or speech. And the HIPPO is just one of the tools in your toolbox. And that's very important, especially if anything ever happens.
Okay, more chat questions. Does
Sure.
the referring clinician need to be the same clinician who provides treatment via equine therapy?
Well, there's no such thing as equine therapy. Okay. I'm kind of the terminology Nazi for AHA. And the referring provider will probably be a physician, because you'll need a prescription or a referral for PTOT or speech. I would assume that's the way it is in Colorado. It's that way in most states. So the referring person will already be a Medicaid provider. The rendering provider is the actual therapist that's doing the treatment. And then the facility, if they're going to bill, they need to have a billing provider number. Did that help?
And yep, Lena, did that answer your question? Or unmute yourself if it didn't. I'm going to go to the next question. How will a center charge a center fee in order to be compensated for the portion that we contribute to the therapy session? It seems that working with Medicaid may be very different than what we have experienced with waivers.
Mm-hmm. That I am not 100% sure how to guide you on, because you have to look at what is standard practice in Colorado. So I can give you you cannot, do you pass on a facility fee to the consumer, to the client, under your current process? Okay.
Some do, yeah.
Okay, so Medicaid, the standard approach to Medicaid is you can't pass that charge on to a Medicaid patient. Okay. Hopefully the reimbursement rates are a little better, and maybe that offsets that situation for you. And, it's voluntary to become a Medicaid provider. I mean, you certainly aren't required to do this. This is just one more option for you. So I don't know if any of you other Colorado therapists have experience with other scenarios Medicaid is the billing entity, or sorry, the reimbursement entity, and trying to pass on a fee to the family. I know in New Mexico you can't do that at all.
I don't believe in Colorado you can either. Sorry,
I know,
Katie, I saw you. Go ahead, Katie.
Yeah, I can speak to this a little bit. It gets a little bit into the weeds for that group provider designation.
Okay.
So if the center is designated as a recreational center, like many therapeutic riding centers would be, then underneath the CES waiver, those facility fees can be paid for the CES waiver separately from therapy fees. There's a line in the CES waiver that says we will pay for recreational fees and if the purpose is to access therapy at that facility. Typically, that would be like a therapist providing therapy in a swimming pool, I think is where that language comes from. But in that scenario where the client has Medicaid coverage and the CES waiver, and which many clients do have both of those, then you can pass on the facility fee to
through the waiver budget.
Through the waiver program.
Okay.
But oftentimes that's not even the therapist doing that. They just provide like the paperwork and then the client manages that on their own.
Okay, cool. All right. So this is just going to be sort of an education process, to the, thank you. That's good information to know. And that should make some folks.
There's another little kind of important piece of that.
Sure.
If the group provider is a recreational provider, then the therapist in Colorado has a requirement to do EVV, which is electronic visit verification. So if the group provider is a typical PT/OT speech office, then there's no requirement for that electronic visit verification. But if the therapist is providing therapy in what's considered a community-based setting, which a recreational facility would be, then they have the requirement to do EVV through Medicaid, which is often managed through an app. It's free, but it is an additional level of Medicaid verifying that you're providing the services that you're saying that you're providing.
Kind of like
Katie, can you say that again?
Yes, Colorado Medicaid started something called electronic visit verification, where OT, PT, and speech providing services in the community have to do electronic visit verification. I haven't done it myself. I'm sure others on the call have, so they may be able to speak more clearly to it. But there's an app essentially where you press a button when you start the visit, you press a button when you end the visit. There may be more involved than that. But if you are providing services in what's considered a community-based setting, so if your group provider is designated as recreational, then you have to do that electronic visit verification for every visit.
So
Okay.
Katie,
But,
then
I'm sorry. But if your group provider is considered clinical, Katie, then you probably don't.
Then you don't, but you may also not be able to pass on those facility fees through the CES
Gotcha.
waiver. It would probably depend on your case manager.
Gotcha. Thank you.
Yeah.
so that looks like that then you actually have two different options, going back to what I said at the beginning. One is making sure that your business structure somehow can support the healthcare component, the therapy component, either through a secondary, just like a division of your corporate structure being like a secondary business, the therapy business, or you could do what Katie just described, and sort of, it does put the burden on the therapists to do that electronic verification, but it might open the door for passing on those facility fees. So it's good to know that you might have two different ways to go. And
I will say that Lena put in the chat, EVV is that simple. You check in and check out, and it's attached to the GPS of your device, so Medicaid can confirm you were there.
oh, good. Okay. Well, that might be a simpler route, especially if you don't have a really big practice component. If you've got a big facility that's only doing, a day of therapy a week with one therapist, it might make more sense to do it just like Katie described and not have to, and just lead with your recreational facility.
And there's another
identification. Yeah.
question in the chat. I had a provider ask me, well, how do I write an order to include equine movement for my patient? Is there specific verbiage needed to educate providers on writing specific orders?
You don't need orders. You do not need orders for a tool. That is really, really important. And so you don't tell the doctor, you know, the doctor doesn't tell you which therapy ball you can use. The doctor doesn't tell you that you can't use Candyland as a language activity or whatever. Okay. So you've got to really get your minds wrapped around the idea that hippotherapy is just a tool. It's a dynamic movement tool. And when you're off the horse, if you're grooming the horse, you're just doing PTOT or speech. That's not equine assisted therapy. That's just therapy. I could groom a rabbit and it would be the equivalent. Okay. So that being said, prescriptions or referrals are for PT, OT, or speech. No tools. They do not need to prescribe. Besides that, it's your clinical judgment on any given day whether or not you're going to put that patient on the horse. And I recognize that most people will gravitate to you as a therapist. They want the hippotherapy to be part of their family member's treatment plan, but it's just a tool. So if you, in your judgment on a given day, it's not appropriate to put that person on the horse, you don't want a prescription hanging out there or a referral that mandates that you have to put them on the horse every single time. That's your clinical judgment. And medical necessity for PTOT or speech is governed by just that, medical necessity. It's not, those prescriptions should never be governed by the tool that you use. If you need an additional clarification. So say I have somebody who's been referred to Skyline for physical therapy, and I know that there is a contraindication for putting that patient on a horse, or there may be a contraindication. I can certainly get on the phone and talk to the referring doctor and say, hey, I have a concern. Do you know that horses walk 100 steps per minute on average and da-da-da-da-da, and I'm worried about whether or not this is okay for this individual. And you can have a discussion and you can get a letter of, you know, from the doctor saying, no, it's all right, or no, we shouldn't do it, or whatever. But that's a separate thing from any kind of a referral or a prescription, and it always should be. Sorry, I'll belabor that one too far if I'm not careful.
Any other questions or comments? And you can put it in the chat if you want, or you can just unmute yourself. That's also okay.
Katie, I don't know if you will have an answer to this. The whole idea about using the facility fees as a community service area. Is there the possibility that that will change in the future when they potentially start paying for adaptive riding?
I don't imagine it would, because it's in a completely separate area of the CES waiver. So the CES waiver has certain services that it will pay for. So right now, those are things like hippotherapy, as well as I think massage therapy. There's certain services in one section of the waiver, and then there's a whole separate section, and that line about being able to request for reimbursement for a recreational fee is in that separate section. So I don't imagine that section will change in response to the current adaptations for adaptive horsemanship, but there's no guarantee with Medicaid when or how they'll change the waiver.
Okay, do you happen to know, just for my knowledge and sort of understanding the system, do you know what section is that under? It's separate from adaptive recreation then?
It is. I can go look, but I don't know off the top of my head.
That's fine.
But
I can go look at it too, but I just thought if you happen to know.
yeah, I have your email, Heather, so I'm happy to email that out to you.
Oh, that would be great. Thank you.
Okay.
Just get a better understanding of the whole system and how it might change.
Sure, definitely.
So what was that last question that popped up, Kathy? I'm worried that a PATH center, I didn't catch it before.
Okay, I'm worried that a PATH center will not be able to serve someone billing Medicaid who does not also have a waiver.
Well, I mean,
It's So here's
yeah.
my reaction to that. Putting my old ED center hat on is
Right.
if you're not able to if you need the center fee covered and Medicaid isn't going to cover it, then that is a great fundraising opportunity. Lena has her hand raised.
So Colorado has Medicaid and they also have Denver Health Medicaid, which is not the same thing. Does this apply to all Colorado Medicaid, including people who are through Denver Health, or is that not part of this?
Well, that's a really good question, because I've never heard of Denver Health. I would suspect, because this was at a legislative level at the top end of human services, that it would apply across the board. But I mean, I guess I don't know that for sure. If Denver Health, I mean, in other words, there's Medicaid, and Medicaid, you can have different management organizations, MCOs, or it sounds like, is Denver Health, like, is it guided, is it more adult or pediatric?
I just Googled it, and it looks like Denver Health Medicaid is the same thing as Health First Colorado, Colorado's Medicaid program.
Okay, all right, so it should cover everything. And
it says Health First Colorado administered by Denver Health Medicaid Choice.
Okay.
Is for individuals who live in these certain counties. And so I would agree with you, Ruth, because this was legislative, it's got to apply.
Yeah, I would be very shocked if it didn't. And probably because you've got some underserved areas, it might be that, that there's an intermediary management organization, like a healthcare management organization, that's helping to mitigate Medicaid in those areas. But you really can't have two separate Medicaid. There's not two separate Medicaid offices in Colorado. There's one. So I think the answer to that is that it's all under the purview of Medicaid at the top.
And going back to Lorraine's question about someone that doesn't have a waiver and Medicaid, the billing, I don't know how much difference this will make, Lorraine, but the billing is higher for Medicaid than it was with the original language.
Right. And, as somebody that's done this for 41 years, and I'm well aware of the additional cost of horses, and I don't use any volunteers. I've got all paid horse staff. So, I mean, it's, I understand that the nuts and bolts of it, and the simplest advice I can give you is within your therapy services, you've got to really maximize your services, maximize your schedule, and figure out what your critical mass is and figure out what your break-even point is. And when I say that, there's a magical number of sessions that you need to do that makes it work financially. And that sometimes gets overlooked. And there should be, I mean, certainly AHA is we're trying to put together some little business modules that'll happen later on this summer, right? Some more lunch and learns that are specifically to those kinds of questions. So, because it's really just the same issues that any private practice has. There's a lot of expensive tools out there, and there's a lot of, Brent can tell you. And I mean, private practice is not always for the faint-hearted, huh? But there's a way to make it work. So.
And Adam just put in the chat for information about recreation center fees. He put a link. Page 69 and 70.
Oh, good.
Thank you, Adam. And I'm gonna we're recording this. I mean, we've got most of it, and so I will I'll get some notes written up that includes all these references and links, and send it out to all the Colorado Path International centers. That hopefully that will help you as you follow up on what you want to do.
And because I have become very vested in Colorado having this work, as you go forward, I mean, you have, like I said, you've got a task force that was organized through AHA of therapists that have been very dedicated to trying to answer the questions and find out the procedures. And so reach out to the AHA office if you're hitting a roadblock, and they will put you in touch with me or with one of the people, you know, with Autumn or Heather or one of the folks on the task force. And if we don't have the answers, we will try to help you find them. Brent's been involved with that, so that it's not a overwhelming process. I mean that sincerely.
All right. Any other questions or comments? If not, I'll give everybody 15 minutes back of their life. I just want to close by, Ruth, did you have something else you wanted to say before I close?
No, I was just going to say I'm just really excited to see so many people join us tonight. Really excited.
Ruth, can I ask you a question?
Sure.
Yes.
Okay, after 40-something years of billing Medicaid, what's been
Yeah.
the biggest hurdle that you've found? I mean, it seems fairly cut and dry when you start to learn about it, but I know that can't possibly be the case. So what's been one of the biggest things you've had to overcome or figure out in that process?
I actually have had a wonderful experience with Medicaid in New Mexico. 72% of our children are on Medicaid. And so if they didn't have a pretty dang good system, there'd be a lot of people without services. And I've never had any problem with the hippotherapy piece of it. There were times when the fee structure might be a little less than I needed it to be, and I had to, you know, really figure out what I was talking about, that ideal magical number. But I really have the biggest problem I've ever had is that New Mexico typically these days has at least 3 or 4 managed healthcare organizations that divide up Medicaid. And usually 3 of those will be really good and 1 of them will be really crummy. And they'll be the ones that's hard to get the referrals through just because they're a cumbersome system. But otherwise, I have found Medicaid, once you get on it and you know what you need to provide them, Medicaid's, for me, is easier than commercial insurance. Hopefully that will be y'all's experience.
Thank you, Ruth. Adam is complimenting you, Ruth. You are not even a part, you're not even a part of Colorado, but so much a part of the EAS industry. Thank you for all you have done. And that's exactly what I was going to say. First of all, I really want everybody to understand that both Ruth and Adam have done the heavy lifting on this entire process. And they deserve great kudos and much of our appreciation. I know there have been other people, don't get me wrong. I know there have been other people that have helped you along the way, but Ruth and Adam, thank you so much for making this happen. And I want to thank you, Ruth, and American Hippotherapy Association for reaching out to PATH International and saying, now's the time for us to start working together on this. Because I think it's a really great partnership and we're making some good headway, both for the therapists and for the therapeutic or adaptive horsemanship. So I just want to close by sharing our appreciation for all of your hard work and all of this good information. And everybody saw, I hope, the links to who you can reach out to for more questions. You can always reach out to me at the PATH International office as well, and we'll just make sure you get your questions answered.
Right. Absolutely. And don't be overwhelmed by it. It may seem like a really cumbersome process, but it's just, you know, baby steps. Just start through the process and it'll come together.
The other thing is Medicaid does have a lot of, there is a billing training online. It's only one, it's a Thursday a month, but it is online. They have billing, they have manuals on how to get a Medicaid number, those kinds of things. So there is information on the Medicaid website for people who are trying to sort things out, just for a little more moral support, that there is stuff out there.
Oh, I have one parting piece of advice. So at some point, if you are providing Medicaid, you probably will be having to have a Medicaid site visit where literally somebody from the Medicaid office comes out and sees what you're doing as a therapy entity. And when you do that, it would behoove you to have it look a little bit like you're doing more than just putting people on horses. Okay, that in other words, your therapy, represent your therapy in a balanced fashion. And that just is a kind of an important little thing to tuck back in your head. So.
All right. Anything else? Well, thank you very much for joining us.
Yes.
And thank you, Ruth, for sharing your wisdom, and everyone else. And like I said, we'll try to put something together. You have people to reach out to if you have more questions, and we will keep you posted as we learn more about the Medicaid waiver program.
Right. Right. All right. Yeah.
All right.
Go for
Good night.
go
Good
for
night,
it.
all.
Do Medicaid work.
Exactly.
Good night. Good night.